Hello everyone, my name is Dr. Jonathan Williams and I specialize in infectious diseases. Today I would like to talk to you about chickenpox, a highly contagious disease that has affected countless lives across the globe. Chickenpox or varicella is caused by the varicella zoster virus, a member of the herpes virus family. The origin of this disease can be traced back to ancient times, with descriptions resembling chickenpox appearing in historical texts as far back as the 9th century. The term chickenpox is believed to have been coined in the 17th century, possibly referring to the mildness of the disease compared to smallpox. The primary source of chickenpox is an infected individual. The virus is transmitted through respiratory droplets when an infected person coughs or sneezes, and it can also spread through direct contact with the fluid from the characteristic vesicles or blisters that appear on the skin of an infected person. These vesicles contain high concentrations of the virus, making direct contact a highly efficient mode of transmission. The vectors for chickenpox are not external carriers like insects, but rather the infected individuals themselves. This person-to-person transmission makes outbreaks common, especially in settings where individuals are in close contact, such as schools and daycare centers. Geographically, chickenpox is a global disease, affecting individuals in both developed and developing countries. However, the introduction of the varicella vaccine has significantly reduced the incidence of chickenpox in regions where vaccination programs are robust. In areas without widespread vaccination, the disease remains more prevalent. Chickenpox primarily affects children between the ages of 1 and 10. While adults can also contract the disease, it is generally more severe in this age group. Pregnant women, newborns, and immunocompromised individuals are at a higher risk of developing severe complications from chickenpox. The symptoms of chickenpox typically begin with fever, fatigue, loss of appetite, and headache, followed by the appearance of a red, itchy rash. The rash progresses to fluid-filled blisters that eventually crust, cover over, and form scabs. The rash often starts on the face, back, and chest before spreading to the rest of the body, including the inside of the mouth, eyelids, or genital area. While chickenpox is generally mild in children, the disease can be serious, especially in adults and those with weakened immune systems. Complications can include bacterial infections of the skin, pneumonia, encephalitis, and hepatitis. The fatality rate for chickenpox is low, especially in children, but it can be higher in adults and immunocompromised individuals. Proactive measures to prevent chickenpox include vaccination and practicing good hygiene. The varicella vaccine is highly effective in preventing the disease. It is recommended for children, adolescents, and adults who have not had chickenpox. Good hygiene practices such as regular hand washing and avoiding close contact with infected individuals can also help reduce the spread of the virus. Diagnosis of chickenpox is primarily clinical, based on the characteristic appearance of the rash and associated symptoms. In certain cases, laboratory tests such as polymerase chain reaction (PCR) testing or direct fluorescent antibody (DFA) staining can confirm the presence of VZV. Treatment for chickenpox focuses on relieving symptoms and preventing complications. This includes the use of antihistamines to reduce itching, acetaminophen to lower fever, and antiviral medications such as acyclovir for severe cases or individuals at high risk for complications. It's important to avoid aspirin in children with chickenpox due to the risk of Reyes syndrome. In terms of current research, significant advancements are being made in understanding the varicella zoster virus and improving treatment and prevention strategies. Studies are ongoing to develop more effective antiviral therapies and improve vaccine formulations. Research is also being conducted on the long-term effects of chickenpox, such as shingles, which is caused by reactivation of the varicella zoster virus later in life. While chickenpox is a disease that many consider to be a benign childhood illness, it can have serious consequences for certain individuals. Through vaccination, public health initiatives, and ongoing research, we can continue to reduce the impact of chickenpox and protect vulnerable populations from this potentially severe disease.